This is the called slit lamp examination because also called biomicroscopy. This is most important equipment used in the ophthalmic examination for the diagnosis, and almost 90% of the diagnosis can be made from this examination with this machine. Now it is a machine which represents the old loop and the torch. The loop is for viewing, and the torch was for the illumination of the eye or abnormalities of the eye. This is the modern modification of that, in which there is one viewing system. The viewing system is this one. This is a microscope in which we can see the magnified image of the patient's eye, and it has this microscope. It is binocular microscope with an illumination of, there is an eyepiece 10x magnification, and then the magnification can be changed with this stick from 1x to 1.6x as well. So this can also enhance the magnification as well. So this is a viewing system having a microscope, binocular microscope, in which the magnifications can be changed. There are other versions of this slit lamp in which further magnifications can also be changed. Then there is an illumination system in which there is a bulb lying inside this one. This is the hosing for the bulb, and then from there the light comes through in this tube, and it is thrown over to the mirror, and from there it is reflected to the eye of the patient, and it illuminates different parts of the eye. It has got it is called slit lamp because it has got a slit. So that is why we call it a slit lamp. Now if you look at this one, this has got a slit of the system. Here the slit is more it is focused over there. Both the slit of the illumination and the microscope, they focus at the same point. So it has got, this is called slit lamp because this is the whole light of this one, and then we can change this light, round light, into a slit to see more details of any abnormality like we are doing here. So you can make a slit of this. It has got a height and a width. So you can change the width of the slit as well as the height of the slit, and at the same time you can measure this height, and from there you can see this one, there is a scale over there, and from this scale you can measure in millimeters the height of the slit, and from there here you can check with this the width of the slit in here. So you can, this is the 0 1, and then this is becoming the wider and wider. Now there are there are filters in this one. You can see that this is a diffuse type of illumination, a scattered light over there, and then you can put a filter in this, and that is called a polarized filter, and then you can put a filter that is called neutral density filter in this one, and this is a neutral density filter. Then there is a green filter in this one, and then there is another filter in this. So this is a green filter, and then you can this is a blue, cobalt blue filter, Now the use of this is when we are going to examine the patient intraocular pressure with this gold manometer and a fluorescent stain, then this blue filter is used because it enhances this fluorescent, which is normally a brownish color. It changes into a green color in this blue filter. This is a joystick which moves it forward like this one, and then backward, and then laterally on the right, towards the right and towards the left side. And also there is on this joystick there is a wheel which can change the height of this slit lamp, and we can do up and down with this slit lamp. Now this is the illumination system and the viewing system, and this is another where we place the patient's chin over there, and also the forehead with this band. This is called chin rest, and we can change the height of this chin rest by moving, and so this can move the eye up or down of the patient on this chin rest. And this has got an adjuster in it, so we can. There is another one. This is called a fixation target, and this can be used. A fixation target like this, it has got illumination in there, and so we can use this fixation target sometimes to show the patient this fixation and to work on the other eye of the patient while he is looking at this eye with the one eye. We can examine the other eye while the patient is fixating with. This is called fixation target. And then when we are not using this fixation, this can be moved on the one side of the patient. These are the parts of the slit lamp which we can use. Now these illumination and the viewing systems, they can be moved around a central axis, and there are marking of the angles. We can actually change it and measure the angle between the illumination and the system, and this is the angle where these are the marking of the angles at which we can change the illumination and the viewing system or magnification system. We can use different other equipments with this slit lamp to perform the other examination or tests or investigations. Like we can use this one. This is a Goldman applanation tonometer. It has got one body in it, in which there is a spring which has got a specific power, and then there is a prism. This is called a prism in it, and this prism can applanate. This has got an area which applanates the cornea, and then we can see with this slit lamp through these prisms, and they will show the two broken half circles, and when these circles they coincide like each other there, we will show it in the slide. Then this is a neutralization point, and then that reading can directly be read from this dial over there, and this shows the graduations up to the 7 or even up to 8. So it can measure and we can read it from there. Graduation number is equal to 10. So if it is 1, then it is 10 millimeter of mercury, and each small graduation is equal to 2 millimeter. So then we can read directly the intraocular pressure from this. This is called applanation, Goldman applanation tonometer. Can be swung from one eye like this one to the other eye like this one here, and then we can bring it down on this side, and we can bring the illumination system on this. So if we want to examine the right eye, we use the illumination on the right side and like this one, and if we want to examine on the left side, we should go like that, and so the illumination system should be on the left side of that. So that is how we can do it. We can perform a drop. There are other lenses for examination of the fundus. This is a 78 diopter walk lens. This is called a biomicroscopy, fundus biomicroscopy, by which we can examine the fundus, which consists of the retina and the vitreous.